hospitals, physician practices as well. This is what you need. This is HiLite Health. There's a problem in the system we cannot ignore. Out-of-pocket expenses for the patients has really soared, and they can't pay to balance the treatment they can't afford.
Welcome to the HiLite on Healthcare video series. In this episode, Bryan Graven talks with Matt Katz, principal of MCK Health Strategies, about the business of healthcare.
Hey, greetings, everyone. This is Bryan Graven. I'm the CEO of HiLite Health, and welcome to our podcast. This podcast is really about healthcare, different topics, and join with me today. Really excited about this individual right here. Known him for quite some time. Name's Matt Katz. Great history of different healthcare background, worked for the American Medical Association, the Connecticut State Medical Society, owns his own consulting company, MCK Health Strategies, has been in healthcare for an extensive amount of time, knows just about everyone in the industry, and really want to pick his brain today on the business of healthcare. Matt, welcome.
Thank you, Bryan. And, it is a pleasure. We've known each other for a number of years. All around the physician practice, technology, and payment arena. And it's kind of neat coming back with you to talk more about what's happened over the last few years, what are practices looking for, what are systems looking for, and I think, quite frankly, how well HiLite is positioned to help all of these providers ensure that they are financially viable moving forward.
Yeah, that's great. So before we get into today's topic of the business in healthcare, so you've been at MCK Strategies for quite some time now. I believe we connected first at the Connecticut State Medical Society. You want to talk about that transition and how you ended up where you are today?
Sure. Well, I had been running medical associations for about 25 years. As you mentioned, the AMA, Connecticut State Medical Society, also the American Academy of Pediatrics. Wow. And I felt it was time to make a change. Instead of dealing with a board of 40 or 45 physicians, kind of working more one-to-one with practices, hospitals, health systems, and other entities. And so the timing was right. Well, I thought the timing was right, and then COVID hit, so it wasn't as right as I thought. Sure. But it was right before COVID. I had gotten some offers to help some entities that were fairly large out, which I really couldn't do when I was employed by a medical association. And I was also at the time, as you know, Bryan, because we were working together on it, working on health information technology and practice solutions and resources to help them maintain their practices and even expand their practices. And I felt that I was limited in where I was and what I could do for these practices. So I decided to go off on my own and create this consulting firm, and I've had a fun time doing it for the last few years, and been working with you again, which is great. And I really do think that the reason I left the medical society and to try to help these practices and other entities has to do with the technology and solutions that that HiLite has, because without those kind of solutions today, these practices are really dead in the water when it comes to maintaining their financial viability. You can't do it by paper anymore. You can't do it with a handshake and a pay me whenever. It unfortunately doesn't work anymore, and you've got to set up systems and processes. And many of these practices, because they have not had them before, need help figuring out how to best set that up for their practice and their patients.
Yeah. So when I talk to a lot of healthcare providers out there, they talk about why they got into the industry. Certainly, it's a noble profession. Patient care is top of mind. But I think what a lot of healthcare providers today are wrestling with is really the complex business nature of healthcare. And it is a very complicated business structure these days. You want to speak on that a little bit?
Yeah, I mean, it's really over the last few years, physician employment or ownership of physician practices from other entities has exploded. And we still have a large number of independent practices and independent physicians, but more and more of these practices are owned by other entities that take on certain responsibilities and roles, but still leave a lot of the practice management to the physicians. But they expect more too. These are business entities that expect more business management. So we not only have this consolidation in the market, buying and selling of physician practices and consolidation of practices, but we have health insurance growing at rates that we've never seen before. In fact, I believe September, it was something like 28.2% of an increase in the premium
Wow.
on health insurance. At the same time, a recent report came out from the Health and Human Services that showed that 37 million individuals last year used telehealth services, which generated more than $6 billion in revenue for physician practices. Though they didn't see $6 billion, they had a hard time collecting because the patient wasn't in front of them. The patient was somewhere else. In many cases, the patient was in a different state and they didn't know what to do, and they still don't. So we've had this evolution of technology for remote patient monitoring, telemedicine, telehealth, health insurance growth, high deductible health plans explode. So there's more consumerism, more patient responsibility. At the same time, the patients are paying more for health insurance, and all this technology is out there. It's a mess. It really is. And no one is effectively communicating. And you get a bill and maybe 6 months late. You don't know what it's for, and you can't figure out if you've met your deductible or not. Who's responsible? You basically need a degree today to figure out your EOB or admittance advice. It's that bad.
Yeah, you're saying a lot of really big pain points throughout the industry that I hear. Obviously, there's the complications with billing claims out to the payers out there. It's the increased costs of technology, because it's almost like if you don't have the right technology, you're not even in the game. You have to look at staffing concerns, telemedicine. That's another big area of growth. And I think you kind of honed in on it, but really that patient responsibility area, where you have a lot of self-funded employers having different types of plans, which have evolved over the last decade or so. But now the onus is really on the patient to pay the healthcare provider the majority of what their out-of-pocket expenses. So there's a lot going on in what you're saying right now.
No, I agree. And I think not just the patient, but you're right. You brought up the employer. Because smaller groups can now self-fund, self-insure, they're also on the hook. So trying to figure out all those payment models and mechanisms are huge. And you also brought up a big point, which is staffing, where we've lost a lot of staffing in healthcare. So the people that understood billing, that understood communications in the practice or hospital, they're gone. And it's hard to recruit and retain. I mean, it's a difficult time, whether you think a recession's coming or not. It's a difficult time, and staffing is difficult. Automation, quite frankly, has become the key for success for many practices, and especially when it comes to billing and collections, because without that, you're either limited by the number of staff you have, or you're limited by what your staff know. And so automation is important, especially when you're spending all this money on EMRs, telemedicine, and remote monitoring. It's important to spend a little bit to make sure you can actually bill, and more importantly, receive payment for those services that you're providing.
Yeah, that's right. So you're kind of diving into today's topic as well. I mean, we could talk about a lot of different pain points throughout healthcare right now. There's cybersecurity, there's telehealth, there's IT investments, all these different things. But let's hone in on really the financial side, because I think if most practices out there, if they're not financially solvent, then they can't treat the patients that they want to treat. So let's talk about really the growing patient burden in healthcare, and really your take on how healthcare providers can either utilize technology or process, or even people to help get their arms around really those struggles in that area.
Sure. Well, as I mentioned before, the high deductible health plan. So you've got these plans now that put more of the onus on the consumer, on the patient, to pay until they reach a certain level. And then there may be a donut hole, there may be a health savings account tied in, but they are responsible for that payment. And when you're paying $600-800 a month for the premium already, when you get a bill for a few $100s for a service, it's like, oh, wait a second, I just paid $600. How do I have money for that? Oh, I'll let it slide. Where before it was they were paying $50, $100 for insurance. So if they got a bill, they paid it.
Sure.
Now it's kind of like, well, didn't I just pay all that money for the insurance? Why do I have to pay this now? Isn't insurance supposed to pay? Well, it's that threshold of, when they hit that level, then it becomes easier because it's the insurer in some respects, but it also becomes more difficult because the insurer now has all these prior authorization requirements and all these other burdens that make getting payment from the insurer just as difficult as getting it from the patient. And with you used to be able to send out a bill 30, 45 days later and get paid within a week or two. These timeframes for many practices have gone to 90, 120 days.
Wow.
And their bad debt, I read somewhere that bad debt used to be 3 to 4% of a practice, and some practices, especially OB practices, some surgical practices, are at 15 to 18% bad debt. I mean, you can't survive as a practice today providing your service for free, and that's what you're doing when you have that level of debt, right? If for 80 cents on the dollar is all you're getting, you're going to be out of business very quickly, and you can't simply provide more services because you're losing more money. So if you do more, you lose it quicker. So you have to find a solution, and that solution really, I think, comes in the form of automation and some of the products and services that HiLite Health offer. I mean, it's those kind of upfront understandings for the patient so that they have some contractual obligation to pay through credit card services or billing services make a lot of sense today. You didn't need them in the past. You definitely need them now. And it's better to talk to the patient upfront than wait 60 days when you send them a bill they didn't expect to get, and they have no way to pay it, and they see $600 and not being able to make payments off of that $600 or find a way to do that. And banks aren't providing patients with, most banks aren't providing patients with that money unless you've got some sort of program set up. And so it makes it very difficult. There's very few banks willing to engage, and there's very few companies helping practices make sure that patients understand what's going on, what their obligation is, and how best to pay it so that their obligation is taken care of without so much burden, and the practice doesn't spend more than the cost of the service on trying to collect.
Yeah, so a couple of things that I think from a process perspective are very necessary, is having some type of patient estimate. So that really that transparency, because the patients are now consumers now. And before they receive the healthcare services that they need, well, it's good for them to understand really what they're on the hook for to pay. So that's certainly one of the assets available within HiLite. But beyond that, I think the average deductible for somebody in the United States is $2,500. That's pretty significant. Family, I think, is $4,000. I think that was reported by the Kaiser Family Foundation. And you look at that, I don't know, most people don't have $2,500, $4,000 lying around.
Not at their fingertips, definitely.
to pay for healthcare services. So I think you need to almost pivot and look at really what the financial health is of the patient and how to engage the patient financially. That way they understand what they are responsible for, and you have a valid solution so that you can offer them either a payment plan or some type of patient financing through a lender.
Well, and I think you're right. I think if you do it in a transparent way up front and in a way that they understand, don't make the payment program so convoluted that it's the first Tuesday of every month at 4:00, you owe X percent of something. If you make it easy and you make it transparent, it works for everyone. And I think that's part of the problem with some of these collection approaches that, again, don't get at that transparency, don't get at that understanding. Making it easy and easy to comply with the obligation, understanding the obligation, and having a way to take care of it that isn't such a financial burden all at once is critical. And it will help everyone.
Sure. And I see a lot of, I think payment plans offered by most medical practices used to be the norm. But now I think the volume of the patients really taking advantage of that has increased, and those defaulting on those internal payment plans has increased as well. So that's creating more of a financial burden for most medical practices out there. It's taxing the staff because now they got to follow up on patients who owe balances. There's credit cards that are on file that aren't working. So it's an administrative burden as well. So what are your thoughts on really what the ideal solution is for a medical practice out there if they're looking to offer some kind of financing, but they don't want to do it on their own?
Well, so I think we've talked about it. You might hear my dog in the background. He's kind of chiming in to agree with me. The solution where the practice has to do it themselves has become an incredible burden. And you're right, it is a burden on the staff. I know some practices, they have someone full-time and all they do is follow up on the collection where they put together a payment plan for patients, but the patients are falling behind. And so you're spending actually just as much time as you would have otherwise with the staff doing it, and you're not getting paid. And then you have the unpleasant situation where these patients are coming in and have to have the conversation in the office. So something that is automated, something that is tied into a third party seems to be a better way of approaching it. That automation is critical. It saves on staff time,
Sure.
It makes it easy for the patient. And if it's happening, automatically from a bank account or from a credit card transaction, so much easier. Having to have, many of these practices are still, write a check to us once a month for a certain amount, but then they don't get the check, and then they have to go chase down the check, or the check is bad and they have to pay $25 on the check. None of that really works today, and most people aren't bringing checkbooks to the practice either. So something that's more automated, something that's tied into the practice, whether it's the billing system or some other system, is important. Some of the worst comments I've read on social media, which is just a mess of a world for practices, but some of the worst comments I've read tied to physician practices has been about billing and payment and problems with that. So the easiest way to kind of snip that in the rear is to have a good process. And it also helps, I think, some of your social media responses, because they can say, Dr. Smith actually had this wonderful plan. It was easy to set up. I didn't have to worry about it as a patient. They didn't have to worry about it as a practice. And it was a no-brainer,
Sure.
As opposed to Dr. Smith's staff was calling me daily, and I kept on sending them checks and they weren't getting cashed. I don't know what was happening. I was spending more on stamps than on anything else. You don't get that. And that helps reduce some of that social media angst that you see. And a lot of those problems and frustrations of patients are on the payment side. So
Sure.
if you can get automated and do it at the time of visit or before with some estimates, it's even better, because afterwards is very hard, especially when they go back home and they've had the service and it's been a few weeks or even a month. It's hard for them to remember what they had done and where. And so catching them when they're in the office or before and automating this seems to make the most sense, and tying it as best you can to your existing billing or a billing process, as opposed to making it a separate staff intense process.
Sure. And I'm even hearing a lot of patients out there are avoiding care. And I think that's we're seeing patient volumes down throughout the country. And I tend to think that if you owe your healthcare provider a lot of money, you may try to avoid your healthcare provider, even though you need the care. So it's almost like a barrier to care as well.
Well, it's a discomfort for sure. It's like,
Absolutely.
I don't have $600. How do I pay Dr. Smith? And I now got to go, I have to go in for another visit. So what am I going to do? How am I going to set it up? It does create another barrier. Anything that infringes on the patient-physician relationship, creates a hesitancy to be seen, is going to cause the practice a problem. They're not going to have that revenue flow, that patient flow that generates the revenue that they need to survive. And in this day and age, now that we're kind of, whether we're post-COVID or still in COVID in the pandemic, it's critical. And then with all of those remote services and telehealth services, you may not even see the patient for months in the office. So you better have a way of setting up payment, because they're not coming into the practice. So you can't, have that discussion in the practice. You've got to do it tied to the telemedicine visits, and otherwise you lose money that way. And some practices who aren't quite getting as much from telemedicine, but are making up for the loss of inpatient in office, aren't collecting, and their collections are half as much on the telemedicine and telehealth as it was in the office. So imagine that if they're trying to supplement or replace some in-office with telemedicine, but the bad debts actually have twice as much of the face-to-face, it creates a huge problem. And you only go down faster. You don't elevate yourself. You go down that sinking hole even quicker.
Yeah. So what I'm hearing is poor financial management from a healthcare provider impacts patient volume, right? impacts the health of the community because patients are now avoiding care, and even worse, let's just say they don't get the care that they need. The next time they go in to see a healthcare provider, they could be much worse. so that's going to increase the amount of healthcare services required just because they didn't get timely care. And then I think it also goes against really the nobility of a healthcare provider treating patients and responsible for the health of patients throughout the community, and it makes them more of a creditor. And that's really not something that a lot of practices or healthcare providers want to be.
They didn't get into being a physician to be a creditor. They didn't get in to be a collection agency. But many of them, you're right, have to do it, and they don't do it well. And that's the other problem is they because they're so caring and patient oriented and care focused, they don't do the collections and the financial management on those claims that well, but they need to, because they need to be viable, and you need to have the revenue to continue to keep your doors open. And so you've got to have a process. And sometimes there are reasons to do things yourself when you're good at them. And there are other times to have someone else set up a system for you so you don't have to do it, or your staff doesn't have to do it. And it provides you with the necessary funding. And as I mentioned, with bad debt being so much worse than it was before, premiums being higher, high deductibles being higher, and a lot of care taking place not in the office, but from telemedicine or remotely, virtually, it's really been a disadvantage for these smaller practices and mid-sized practices because they don't have anything set up from a billing standpoint for payment and collections, because they hadn't needed to until now. But they definitely need something today, and automation is critical. If it's paper-based, if it's staff-based, it's just high cost and, quite frankly, very low return.
Sure. Yeah, and I think you're spot on with automation. I think with the staffing burdens, all the other responsibilities that the back office has to worry about today, it's really challenging for them to do all of these things for every single patient that the healthcare provider sees, right? And I think without automation, it's such a disadvantage. So beyond the automation, also looking at really your financial solution in place, having a viable financing partner. And I mean, there's patient financing that's been out there for some time now. But what we're seeing is really an uptick in patient financing. And there's a lot of bad actors out there. There's high cost lenders who charge the patient an exorbitant amount of interest. There's credit cards out there that only approve those who have like stellar credit. Like, in your opinion, what's kind of like the ideal solution for a healthcare provider on the financing side?
Well, I think actually what HiLite has is that ideal solution. I mean, and I mean that honestly, which is it's getting away from high interest, getting away from limited qualifications, and getting away from kind of that kind of short-term credit card approach, but having a more longer-term solution for the practice and the patient. Hopefully that patient's going to be a patient of the practice for a long time. And you want to have that relationship. So having something that provides them with comfort, not just today or tomorrow, but 6 months or a year down the road is important. Sure. So you're not just looking for a one-off, right? I mean, years ago, we were looking for a one-off because we didn't have that many patients that had bad debt or needed to find a way to set up payment. But today, you need that. Plus, I think it's important, and HiLite's program does this, you need flexibility, right? You need to provide flexibility not only to the practice, the physician, the other healthcare professional on their end, but you need to do the same thing on the patient end. So if you've got flexibility of payment parameters, timeframes, amounts, and you have flexibility on the practice side, everyone's happy and makes it work, especially if those interest rates aren't exorbitant, where it's like those old credit cards that used to get that were 24.99%, and so, you've got, or those or those day of lenders who take money from your paycheck. You get money and then you have to give them their paycheck and they take 19%. I mean, that doesn't work. So having a program that is fair and equitable to the patient as a consumer and the physician, and making the physician or office no longer have to be that creditor that solicits is, I think, the solution. I think also the timeliness of payment and upfront payment for practices, getting more timely payment, because time is money, and if you're waiting 6 months, that's hard for practice. So if there's a way for them to get money more quickly, that also is a benefit. And that's something that even when they had payment plans in the past and someone was paying $30 at a time, it took forever for the practice to get money. So if there's a way for the practice to get more upfront, that benefits them and benefits the patient.
Yeah, I couldn't agree more. I think a lot of healthcare providers, again, they're there to make people healthy. They're there to treat the sick. And I think if you look at kind of the full equation now, financial health is just as important. And you don't want to really stick the patient with a lender or a credit card company that has high interest rates. It's going to put them in debt. If they miss a payment, like what happens then? And not only that, I mean, if you're doing internal payment plans, well, guess what? You don't want that stuff on your books.
It makes it a nightmare when you try to file your taxes and pay taxes. I mean, I think you're absolutely right. I mean, that's an important thing to consider too, is having something set up that does not burden the practice or the patient when it comes to their credit rating and I mean, that's important. And so having something that is reasonable, respectful, and operational for the practice, but that they don't have to actually do it, that someone else is doing it, hugely beneficial, because the moment you get them involved, it becomes a staffing difficulty. And, they're not meant to be financial billing experts, transactional experts. They're meant to be clinical experts, diagnosing a clinical problem, a medical problem, not diagnosing a credit problem or a credit card or a check problem. And so I think, the thing I hate the most today is walking around and talking to practice and they said, well, we just dropped that to check, or we had them drop that to paper. Well, that means they're basically giving up, and it's going to take forever to get paid if they ever do, but they don't want to spend any more time on it. So I think, again, a system that does it automatically so they don't have to spend that time and it's not being dropped to paper is critically important.
Yeah, and I think you're speaking to today's patient consumer as well. Patients want the automation. They want to be able to pay an invoice or pay something on their mobile device. They want to be able to take out financing easily and know what they're responsible for, and not have to go to the mailbox and check the mail and look at a paper statement. So I think the automation is key, and it's really in line with what other industries are doing today. So that said, Matt, talk to me about today's healthcare consumer. Where are they at? Where are they at mentally? And really, what's their appetite? What are they looking for?
Well, a lot of them are lost, right? Because we're all taught. You talked at the beginning, and I talked at the beginning, the importance of transparency. But it's as transparent and clear as mud, right? Healthcare is so hard to understand. It's not like going to your butcher or going to your neighborhood hardware store where there's prices there and and see and understand what it is. I mean, it is, you don't know what you're going to see as a physician until you really get in to look at that knee or look at that shoulder. You don't know what other comorbidities or other conditions that child may have when they come in for that well visit. It turns out they have an ear infection. So it's really hard to estimate. It's really hard to provide transparency, but the consumer wants it and demands it, right? They want to know. And I don't know about you, Bryan, but I think I went to the post office a week ago and I hadn't been in like 6 months to buy stamps.
Wow.
So they also want real time. And you're right. Almost everything I do on apps or on the computer today, one, because I'm spending all my time in front of computers and apps, but two, it's quicker to do that than it is to write a check. I don't even think my kids in high school know how to write a check. I don't know if they've learned how to write. It's been a while
since I've written one.
Checks. So, I mean, they expect things to be like, the social media is, you plug it on, you turn it on, you know what a friend is doing, you know where they are, you send a quick message and you're done.
Sure.
Whether it's your utility bills or your car payments or home payments, almost everyone has it coming out of their bank account or their credit card billed
Sure.
automatically. Healthcare has been behind, and I think that consumer who wants to be an informed consumer needs to have an outlet for payment if they're informed. And if they're not informed, some of the things that HiLite does with billing actually helps them and helps the practice inform the patient. Because I don't know, I know you've looked at EOBs and remittance advice a lot lately, but I don't know when the last time someone who's been relatively healthy has looked at one of those. But there are more codes, more indications, more notes, and no longer is it one page. But last time I got one, it was 8 pages long of all these legal terms, referenced ID codes.
Sure.
You have to go to the website to figure this out or that out.
It's almost information overload.
It is. Oh, yeah. And it was in 5 or 6 different languages too. So, I mean, it which is a good thing for people who have primary languages that are not English. But I have to tell you, trying to get through that 8 pages as someone who's in the industry was time consuming. I would have rather just had a little, text message or email that says, now's the time to pay, or thank you very much, we've processed your payment. And I didn't even have to do anything other than have set something up 6 months ago. And now I know it's working and I'm happy. I can submit whatever the insurer owes or goes to my FSA real time. I mean, that's the way of not just the future, but the way of today. Unfortunately, a lot of practices are way behind that curve. And as we mentioned, they're still dealing with paper and are going out and buying books of stamps. So we've got to make sure to help them transition to more automation that isn't a negative with consumers, but is positive. I mean, we have even concierge practices where consumers are even more involved. As you mentioned, we have employers who are doing self-funded, self-insured plans. So they need to know, but as they learn, they become more informed, and they don't want to go to a doctor that's going to bill them in 6 weeks and only takes checks or or something else that they have to mail back.
Point right there. Same thing with the doctor that doesn't offer payment plans or financing. They'll go somewhere else.
It is a differentiator today. I mean, remember yesterday, it was almost the opposite. You wanted someone to give you a bill and you wanted to write a check because you felt like there was a connection. Today, people want to kind of have that automatically taken care of. And if they have to wait, if it's weighing on them because they get a check bill later, or because they don't know how to pay it, or they don't know what they're for, it becomes problematic. And it is a reason, as I mentioned on social media, for people to complain. They used to complain about the look of your waiting area. I don't see much of that anymore. Sure. What I see is I couldn't pay my bill. They didn't have a way for me to set up a payment plan. I had to write a check 90 days later when I didn't have money, but I could have set something up ahead of time. That's what I see online today as the negatives. And the positives, I see it was easy to pay. It was painless. We set it up with my credit card and I had no problem. So, I mean, I think it's important that consumerism, that knowledge of what you're responsible for, how much things are, and it ties into how quickly you can then effectively make a payment. And in some cases, not even think about it because you set it up already. So anytime you go to any doctor, it's just coming out of your credit card, or you've got this plan set up and every month you're paying $100, but the doctor already got paid, and you can go back to that practice and feel comfortable and they're happy because they got paid.
Yeah. So if I were to summarize everything, sounds like healthcare providers need to have the right technology, the right automation, and really the right type of financing program to service patients like other industries do, because we need to get up to modern day standards in healthcare, and a lot of healthcare providers are really in still the stone ages of doing a lot of manual things that just aren't working today.
Well, you're right. It's patient focused from the clinical side and consumer focused from the economic and financial side. Sure. Many physicians are very good at that patient focused clinical medical, but they have not done such a good job on that consumer financial side. And I think through some of the products and solutions that HiLite Health offers, many of these practices can find that solution easily, inexpensively, and make that consumer relationship just as positive and beneficial as that patient relationship.
Awesome. So I think we covered a lot on the patient financial management side. I always like to close the podcast with the really interesting question. And I mean, this is kind of a futuristic one, but maybe like 10 years from now, 20 years from now, where do you think healthcare is heading? Where's the future of healthcare for hospitals and physician practices out there?
Well, I think there's definitely still a space for those independent practices, whether you're a primary care or specialist. I think that they used to call it the hospital at the home. Now it's called medical care in the home. I think transitioning some of that care to the home setting is definitely happening and going to happen more, especially for those with chronic conditions. So there's more maintenance and more evaluation, and you're not going in maybe to the office as frequently, but you're still getting care and accessing care. I also think, and it's important to recognize this, that as we make advances in medicine and advances in technology, there may be some cures and some solutions to some things that, you know, we didn't have solutions and cures for, which is going to increase costs for some or everyone. But at the same time, it may allow consumers to have a better handle and control on where they go for care.
Sure.
And there may be more opportunities to differentiate, and for the consumer to say, I'm going to go to Dr. Smith and not Dr. Jones, and these are the reasons. And so if we're putting more in the hands of the consumer, the patient as a consumer, more of the choices there, both medical care, but also financial, you know, we have to expect that they're going to start making choices. And those choices are not only going to be, were they a good doctor and treated me as a patient well, but were they a good, you know, were they good in finance and business and treated me like a consumer, and that like they were happy to see me, and that we set something up to pay my bill, as opposed to, you know, I'm still getting that paper bill mailed to me, and now it costs $1.50 to mail a letter as opposed to 60 cents. And you know, why should I do that? Why should the practice spend? So I think that the technology, remote monitoring, remote care, remote treatment is going to be an increasing part, but there is still a need for those clinicians, and they still have to bill for those services.
Sure.
So it's just different kinds of services, but they need to find a way to automate that. So whether you're at home getting something read and evaluated and talking to the doctor on the phone, or in something in a computer or something, you know, or on your ceiling, you know, you still have to find a way to pay them for that. And so we need to automate that, like we're automating everything else, and not just healthcare, but every other field that is. We just have been behind the 8 ball on how to pay for it, and how to pay for it in a way that respects the consumer, the patient as the consumer, and the doctor as a small businessman or woman, or the clinic, and how they engage with that consumer.
Yeah. I completely agree. I think until they come up with the magic pill that's going to make everyone healthy forever, it's definitely going to be consumer driven, with a lot of technology focus, and it's got to be convenient for the patient as well. And I think that's where a lot of the home care services come into play. So Matt, it was a pleasure having you on the podcast today. You're really gracious with your time. A lot of tremendous information. Love picking your brain. Look forward to talking to you again sometime in the future.
Thank you, Bryan, for letting me be on, and thank you for allowing me to talk to my clients about HiLite Health and the services and products that you guys offer. And you know, one of the things I would say is that what I really appreciate is your ability and willingness to simply talk to my clients' practices about their opportunities, even if they don't go with HiLite Health. You're educating them on what they may need to do, what they may need to change in order to be viable. So I appreciate that. Thank you very much.
Great, Matt. Well, pleasure, everyone. Thank you for joining us, and look forward to the next podcast. Thank you.
Hospitals, physician practices as well. This is what you need. This is HiLite Health. There's a problem in the system we cannot ignore. Out-of-pocket expenses for the patients has really soared, and they can't pay to balance the treatment they can't afford. HiLite pay